So documentation for the NG tube insertion would include the date of the insertion, the length of the NG tube that was inserted, which was 6 to the 60 mark, the size type of NG tube, which was a 14 fringe like the doctor had ordered. I will note the color consistency and the pH of the stomach contents that I pulled out. I will also see what the client's response to the procedure and the teaching was, and I will perform oral care every 2 hours. Mr. Jones, if there's anything else you need, just here's your call light and just let me know. Okay, next I will be doing the NG tube irrigation. I will first come into the room and see that the patient is in high Fowler's. There is a towel on the patient, and I will disconnect the tube from the low intermittent section and lay it on the towel. I will then next check the placement of my NG tube again by taking my 60 milliliter syringe. I will clean it with an alcohol swab, and I will place it in, and I will check the stomach contents. I pulled out 30 milliliters, and it is the green color it's supposed to be with the consistency and the pH for the hospital policy. Whatever comes out must go right back in. And I'm going to do that one more time, but listening to make sure that it is in the correct spot. So we're going to pull it back out, listen at the epigastric, and I hear the whooshing sound that I'm supposed to hear. Next, I'm going to go ahead and flush the tube. I'm going to first pull back 30 milliliters of normal saline water to irrigate the tube according to the doctor's order for irrigation, and I will attach that to the tubing. And I'm going to go ahead and listen again at the epigastric just to make sure I'm going into the right area.
It's going to be a drug.
I'm going to go ahead and push that water in. And now I'm going to take back some of that water. And I only got 25 because some of the stomach saved it. I'm going to disconnect my tubing and then reconnect this to the low intermittent section. I will next go ahead and document the irrigation that I used, which was normal saline according to the doctor's orders, the date of the irrigation, making sure I note the date that the NG tube was inserted. I will also note the characteristics of the stomach contents, noting that I am in the correct place, and the pH if that's what the hospital would like. If there was any difficulties for the patient during the irrigation, and also how they responded to the procedure and the teaching.